what I see as very critical in respect to the global health security agenda is, first of all, collaboration. There are very many players in the field, but the players may be repeating or doing multiple things, but when they collaborate, they do a better job. Sometimes there is lack of collaboration. Sometimes the collaboration does not trickle down to the lowest cadre, to the lowest areas of the country. Some of it is usually national or at the central level. Being away from the national level, sometimes we don't feel the impact of some of the activities that are being carried out at the national level. Maybe it is important for partners to move down to the lowest person, the farmer, the herder, and find out the challenges that they have. And another issue that I found very critical is communication, not just at the top level, communication to the keepers, communication to the people who work with animals. Sometimes it looks like it is missing, and sometimes we go to those people only when we want to collect data. It's important that we engage them from early stages, we engage them from disease control, we engage them from public health aspect, we engage them in all the activities that we do. Another thing that stands out very clearly and very important is an aspect of laboratory capacity. We do a lot of capacity building and training, but when the laboratories are not well supported, some of the resources, some of the activities go into waste, because an ill-equipped laboratory is already a failure in achieving the global health security activities. Another issue that came out very clearly is the issue of feedback, and how do we give the feedback of the activities that we do? Do we share what we find out? Do we engage? Because it serves as a stepping stone for better performance, learning from the lessons we have learned, and it helps as a stepping stone to improve. I work in a laboratory in central Kenya. I'm a trained epidemiologist on top of my veterinary career. And one thing that I've learned, or maybe it's a harsh one because we learn from the farmers. The farmers kind of find a de-link between the services that we offer and the challenges that they have in the field. We try to act when they call, maybe there's an outbreak, maybe there's a disease problem, and take samples for examination. But they always find that the services offered may not be very good. Sometimes the results are late, maybe due to challenges in the laboratory facilities. Sometimes there's inadequate veterinary support. So it's always a challenge, and it's a very big challenge. Sometimes common diseases that they are not engaged or they are not aware about. So there's a lot of awareness creation that needs to be done. When there's an outbreak, they may not even be aware of what is happening until it happens to their farm. You know, there's supposed to be an engagement right from the beginning. So there's usually that kind of de-link, which we try to engage with the county people to resolve. Okay, now maybe my parting words would be that because there are very many partners in the field of zoonotic disease, AMR seems to have come up really very big. But you may be surprised to learn that maybe in laboratories like the ones we work in, it's still a very manual system. Maybe there's a need for partners to relook into the issues and provide automation, to make the services better, faster, quicker, and more also, the better the system, the better the information that comes out of it, and the better the data. So that's what I would encourage the partners to consider looking into.